All right. Hello again, distinguished citizens of the United States. Today, I'm seeking common understanding of what these federal health insurance tax credits are and the environment they exist in to help us better understand this congressional fight and where you may better apply pressure to your representative to do better. My stance is whichever side you're on, we all deserve better representation than what our government is giving us right now. So, as always, I'm looking to go below the red team, blue team meme war and actually find the story from numbers where possible. Today, I'm pulling from the Congressional Budget Office, some government sources, and the American Hospital Association. This is going to be raw, one take. Uh, Maybe I'll polish it and repost it later on YouTube or something. But anyway, let's start out with the definition. The tax credits are rebates to U.S. citizens who get their insurance through the common marketplace. This has absolutely nothing to do with undocumented migrants getting free healthcare. I kind of touched that later, but this is a totally separate issue, which was talked about during the Medicare cuts during the Big Beautiful Bill discussion. So currently, 24 million Americans, US citizens, are using the marketplace and benefiting from the tax credits. Um, so the power statement up front here with the congressional fight and the money, what kind of money are we looking at? So from the Congressional Budget Office, these tax credits cost the US for 2026, $24 billion. Okay, 24 billion in 2026, the US government will spend 5.29 trillion in outlays. That's mandatory, discretionary, and interest on our massive debt. So again, two numbers, 5.29 trillion is the total monetary spend of the US government. That's excluding the tax bill for now, the tax credits. If we were to add the tax, uh, the 24 billion, uh, that is would be in addition to the 5.29 trillion. This is astronomical numbers that we cannot understand. We don't have the brains. We've not dealt with these numbers in our day-to-day and professional life, the family life. So if we were to reduce this down to human readable terms, proportionally using the great skills of math, that would be like saying the US is spending $10 and the tax credits is about a nickel, a little bit less than a nickel, honestly. So we're in a situation where there's a budget in the House and the Senate. Team Blue said, I want a nickel to make healthcare affordable. Team Red said no, but the Democrats weren't kidding. And now that round is fired out the chamber. Team Red can say, the budget is $10. By God, I don't have another nickel. It's too expensive. I'm not doing $10.05. It's $10. And Team Blue is saying 5 more cents gets you affordable health for 24 million Americans. Okay, I'm going to lower the bass in my voice, the excitement here, and just get on with the presentation. But I want to put that in like a ratio that we can understand. We could have a $10.05 budget, but the legislator currently says no. All right. So, like I said, 24 million Americans have insurance through the marketplace. Without these credits, the insurance doubles, more than doubles. So, it's going to raise by about 114%. Again, using real dollars, we're talking the average insurance premium for these 24 million Americans is currently $900, a roundabouts. Uh, this will go to $2,000. So, a little bit more than double. Um, Given that most of these are paycheck to paycheck type Americans, that's going to be a pretty big loss. So, and the 24 million Americans have this insurance. They get to pay more for the insurance, and I'm not thrilled about the insurance companies that benefit from all this either way. But around 4 million Americans will see that price figure and bounce off and say, forget it. I can't do it. It's no. And they're going to be uninsured. Used to be that you had a penalty for not being insured, but that's not true anymore. Um, that that I think that expired in 2017 or something like that. So there's no penalty for being uninsured other than not having insurance and having poor health. So 27 million Americans are uninsured right now, and so um, what happens with these uninsured Americans? Well, they don't get the care, the preventative care, and the routine care that they normally get, which means they wait longer to get their health care, and they end up going to the emergency room because we're the great United States. We don't turn away anyone who needs help in the emergency room. And um, what happens is the hospital will end up eating that bill. Primarily, it's the hospital, um, but it's a little bit the state, a little bit the person of whatever they could pay. But the figure I found from the American Hospital Association is about $40 billion annually is eaten by the hospitals from uninsured Americans. So currently 27 million uninsured. We're going to add 4 million to that. I'm actually going to be a little pessimistically like for this. So if you already have 27 million uninsured, what's adding 4 million more? That's a 15% increase. Um, I shouldn't say it like that. These are 4 million individual American souls who are going to be in trouble. So now to broaden the discussion a little bit, because this is a very complex environment, the rural hospitals, I'm not talking the San Diego hospital that's right next to the border. I'm talking about Owensboro, Kentucky. That's the people who are relying on these low income patients. And so, in times of Medicaid expansion, more low income patients come to the rural hospitals. The rural hospitals have better profit margins. They survive. They hire staff. I know I'm from Ashland, Kentucky, where King's Daughters is like the major business in town, and they have all the nurses and doctors and good jobs. Um, However, we're currently in a Medicaid contraction. Given the big beautiful bill and the cuts to Medicaid, we're going to lose $100 billion in Medicaid each year for the next 10 years. So this was a big issue for rural hospitals because they primarily have Medicaid patients. And so those Medicaid patients are going to be more and more uninsured, or let's say this was revenue that those hospitals were counting on. They'll be raising prices, uh, cutting services and whatnot. All right. Uh, just to put a pin in that, let's move forward and talk about the insurance companies themselves. In 2026, the insurance companies are going to raise the premiums between 15 and 20%. That's independent of everything we're talking about. Um, kind of independent. I'm about to go into why it's not independent. I'm just saying that the doubling of the 24 million Americans' premiums will also incur this 15 to 20% increase. All right. There's a three-way dance between the hospitals, the providers, the patients, and the insurance. Our insurance rates are going up because the cost of healthcare is going up. Now, I'm going to give President Trump two thumbs up here. When we see President delivering the good news, negotiating drug prices, um, we saw him in the Oval Office. I think it was Ozempic and all the other good ones. This is a good thing. So, drug prices is one of the 8 big drivers that make our healthcare costs go up. Say that again. President Trump did a good thing in negotiating drug price reduction because that's one of 8 things that cause our healthcare costs to go up. Okay, another of those 8 things, I'm not going to list them all because this video is way too long already, is the uncompensated care from uninsured Americans. So, yes, President Trump did a good job. Um, this uh, is not the total picture. Our healthcare insurance is also going up because those uninsured Americans are receiving care and the hospital's eating it and then passing the costs on to the rest of us, and our insurance goes up. All right, to say this more simple, the real link between uninsured Americans causing the rise of healthcare for insured Americans is here. So if you are in the middle class, you will pay some of this cost one way or another. Um, Either the government through the tax credits pay, and we have, however we fund the government, or you literally get your insurance premiums raised. As we're seeing in 2026, all of our insurance premiums are being raised, except those of us on TRICARE, and I will have another video on that some other time. Now, um, if you want some straight up cynicism, 2024 profits are down for big insurance company. That's United Health Group, Elevance Health, and Cigna Group. 2024 saw a bad year for them making profits. They're going to turn that bad year into increased premiums for you. Again, partly because we have so many uninsured Americans that are getting care, and we have to eat this. All right. I have just a tiny note on the undocumented immigrants getting free health care. By law, 0 illegal immigrants are on federal Medicare. But about 3.8 billion, this is the number I could find, um, is spent on undocumented immigrants emergency care. And that number is shared between federal and state. I couldn't find it. I couldn't find a proper breakout. Um, but there's a number for you. I'm trying to describe the common reality that we all see. I'll say it again. The undocumented immigrants uh, costing about $3.8 billion per year for the emergency care. I'm all for uh, I'm all for finding better ways to do it. I'm not for turning anyone away from an emergency room. Um, Something more creative than dump 24 million Americans, uh, dump 4 million Americans off their health care, raise healthcare costs for everybody so that we can chase out $3.8 billion of undocumented migrants. But again, as I said up front, this is not even talking about the tax credits. So we've gone long enough, so I'm going to wrap up now. Before leading into part 2, which will be a separate video, well researched, talking about how the Senate is funding these tax credits and where the money's actually is, what a tax credit actually means. I want to say that in 2026, we have a number of GOP senators up for reelection in heavy red states that have high populations of citizens enjoying the federal tax credits. I'm going to name a couple and then just list the states. So Senator Cornyn of Texas has 4 million constituents that take these tax credits right now. On November 1st, which is just next week or so, those 4 million will get a sticker shock, and they're likely going to see their SNAP benefits, and then they're going to call their senator, and then their senator is going to say it's the Democrats, whatever he's going to say. I don't care. I do care. It's not my business. Next one, North Carolina Senator Tillis. He's retiring from the Senate, and he has 1 million constituents taking advantage of this. So North Carolina, um, big time red senator exiting the stage at a time when 1 million constituents are going to feel the pain of these tax credits leaving. Um, so we have Tennessee, South Carolina, Alabama, Mississippi, Oklahoma, Louisiana, all have between 300 and 600,000 citizens using the marketplace. After that, there's 10 more red states that have between 70 and 200,000 constituents on the marketplace. And so when the Democrats, Chuck Schumer particularly, says each day gets better for us, I believe that is a head nod towards November 1st, when these 2026 insurance numbers will slap citizens in their face. At the same time, SNAP dries up, and they start calling their Republican senators saying, hold on a second. Yeah, uh, wait, I'm not going to survive here. Um, it's terrible that the Democrats are using this as leverage. It's terrible. It's terrible. We should never have to be in this situation um, where damned if you do, damned if you don't. I'm going to withhold these benefits until these benefits are approved. Um, but like I said, the round is out of the chamber, and I believe the Democrats cannot back off now. They can't. They've done a frontal assault. They have charged. They have done uh, you know a horrific move, and now they can't come back to the trenches having nothing to show. They have to gain ground of some kind. And the Republicans uh, are going to have to answer to their own constituents very soon. And so it's going to be very interesting where we go. And I'm saying all this so that you may have better uh, information, better context for when you see the memes being passed around. Or what I would really like is for you to call Senator Johnson and tell him to get the House back in order. I'm going to drop that number, and that's going to be my sign out here. So Mike Johnson, 202-225-27777. There's three sevens there. Um, Call, leave a message, tell them what you feel about this, or at a bare minimum, call and say, get your butts back to DC and get back in the pit and start talking. All right. Thank you if you've made it this far. I did not think this was going to go 20 minutes, but we did. See ya.